right, let's broaden this discussion. We're now joined by Jacklyn Kiarie, Program Manager, Amref Health Africa via Zoom. Jacklyn, it's a pleasure to have you with us. So, Africa has finally rolled out mass COVID vaccinations. How is the World Health Organization coordinating the delivery of COVAX scheme vaccines?
Thank you very much. We've seen a lot of assistance from WHO through the COVAX facility, supporting the countries to get there faster. And one of the ways that the WHO is supporting us is in really making sure that countries are ready, that we have the proper plans in the country. We are able to prepare at the national level, at the county level, making sure we can check up our storage activities, making sure that our healthcare workers have the right capacity to be able to deploy the vaccine. So working very closely with them. We have heavy presence of the WHO in the national task forces, and therefore that's the kind of support that is trickling down to each of the counties. So just make sure we are ready for this.
Okay, so we haven't really had very clear timelines of when all of these vaccines will be rolled out to each and every country. So when do you think these countries will get their share?
So the initial target was to have about 3% of the population covered within the first 100 days of this year. That's sometime towards March. And by the end of 2021, we wanted to see 20% of the African population covered. That means about 600 million doses of vaccine delivered through the COVAX facility in Africa.
And what are some of the challenges so far, and how do you intend to address them going forward?
So some of the challenges is that we are sort of dealing with two issues at the same time. As you're well aware, we still have COVID-19 here with us. We have stretched health systems, and therefore the vaccination program seems to be an add-on to what's already going on. So a lot of thought around how do we make sure that there's continuity of essential health services, because it's the same healthcare workers, it's the same infrastructure. The whole vaccination rollout is going to be dependent on the national immunization program. And therefore, how do we balance out and make sure that we don't disrupt the usual essential services while making sure that the vaccination program is going to reach the people it's supposed to reach when it's supposed to reach. And then, of course, we also see in instances where demand outweighs supply. What we're expecting from the COVAX facility is obviously less than what each of the countries requires, and therefore we are looking at how can we expand access by increasing investment for each of these countries directly to be able to procure the vaccine directly from the manufacturers. So those are some of the challenges, of course, issues around service interruption. And then, of course, we're also hearing a lot about vaccine hesitancy. So how do we convince the masses, the priority populations in each one of these countries to accept the vaccine? Because like you're well aware, the reports that are coming out, some of them are not very positive. We still have quite a bit of questions around the vaccine, how fast it was produced, when we expect it, how we are prioritizing the populations, and therefore how do we make sure that the right people get the right information to be able to take on the vaccine so that we can increase the vaccine confidence.
Jacklyn, thank you very much for those insights. Jacklyn Kiarie joining us live via Zoom in Nairobi.